Hello and welcome to another video for EDX Video Pro, the channel for medical education for the healthcare professional. This is Dr. Carlo Ojet, the emergency physician, who I'm going to change things up a little bit today. I've been doing a lot of chest x-rays and radiologic stuff. Let's look at some stuff. 22-year-old man presented to the emergency department with blurry vision and pain in the right eye while he was sewing an iron wire. He felt a foreign body strike his right eye. Visual acuity was hand motion in his right eye. That means that he couldn't really read anything off the board. He can only see motion of his right eye, and 20/20 in his left eye. Slit lamp biomicroscopy, that means that we actually use a microscope specifically assigned to look at the eye, showed a corneal wound with a wire extending through the lens, resulting in a ruptured traumatic cataract. Let's take a look at this. You can see right here, there's a foreign body, and right here, there's the whiteness. That's the cataract they're talking about. So that's pretty scary stuff, right? You can see a wire going into the eye like that. You can see some kind of inflammation process going on down here as well. It's probably hypopium, or the white cells in the bottom part of the eye area. Let's look at the other picture from the lateral side. Look what that looks like. I mean, there's a foreign body right there going into the eye. Definitely a penetrating globe injury, which definitely meets criteria for emergency of the eye. This is a plain radiograph showing that it actually goes in the whole eyeball. It's probably like this, and then the wire coming like that. And they had a CT performed, because you don't know how long that wire was. It could have gone all the way in here, but it stops at the eye, so it's really affecting just the eyeball itself. So this is a traumatic intraocular foreign body. Orbital radiographs, the x-rays, show the wire-shaped intraocular foreign body much longer than it appeared on the slit lamp examination. So it looked like it was, oh, let's just grab it and pull it. No. This skin goes deep. CT reveals the linear structure extending from the cornea to the posterolateral wall of the globe. The patient obviously received tetanus vaccination booster, IV antibiotics, and was admitted for operation to remove a 21mm intraocular foreign body and corneal wound repair. A pars plana vitrectomy with cataract extraction and intraocular lens implantation, that means they had to replace the lens, was performed in second stage. Final visual acuity of the eye improved to 20/50, so about half of what it should, a little less than half than what it should be. So things to definitely touch base with is anytime there's an eye injury, corneal abrasion stuff, find out tetanus vaccination status and upgrade if necessary. If there's a metallic, kind of like a forceful entry near the eye, the question is whether that foreign body might have gotten into the eyeball. Just because you can flex something from the external part of the cornea doesn't mean there's nothing deeper inside. So a radiograph can rule out definitely metal, and if there is metal, then you do a CT scan to further define the anatomy, make sure this didn't go all the way into the muscle or into the bone. That would be a much more complicated surgery. So then that CAT scan is definitely helpful in the decision making and planning for surgery. And then, of course, broad spectrum antibiotics admission in a hospital like I am at. We have to consult this and transfer them out because we don't have ophthalmology to do this kind of surgery. And I actually have a nice case of a patient with an eye injury that I'm going to do next, since we're on the subject. All right, this is it for today. I hope you enjoyed this video. I hope you learned something, and we'll see you in our next one. Bye-bye.